Hello, everyone. Dr. Stillman here, and today we are going to be talking about inflammation. Now, if you are in the health and wellness space, you know that everyone eventually comes around to talking about inflammation and the related phenomenon of immunity. Okay. Today, I'm going to unpack what inflammation and to a certain extent immunity really mean. And I want to help you guys identify people who don't really have a sophisticated understanding of these systems and phenomena, because I see them, quite frankly, taking advantage of the overly simplistic thinking that people, as a matter of our nature, are prone to in order to sell them things they don't need. This happens to my patients all the time. I make videos like this because I'm tired of debunking these narratives in extensive consultations with patients after they've started working with me, because it really is I hate to say this, but it's a waste of valuable clinician time, which I really want to help my patients use to their greatest benefit. And of course, to apply to work with me, go to stillmanmd.com. Without further ado, let's talk about a really interesting phenomenon that really makes a lot of the hay for the inflammation, let's call it bandwagon. So non-resolving inflammation. So let's talk about what inflammation is supposed to do. So inflammation is supposed to clear problems in the body. You sprain an ankle, you get an inflammatory response: tumor, rubor, dolor, pallor. Those are the four Latin terms for pain, redness, swelling, and heat. What's happening there is the tissue's been injured. Injured cells produce these pro-inflammatory, these inflammation promoting chemicals. The body responds by sending in lots of different factors, some of which are immunological, but all of which are supposed to resolve the inflammation, repair the damaged cells, clean up any kind of infectious agents that may have gotten in through a wound. A lot of this is actually very therapeutic. For example, have you ever thought that, when you get swelling in a joint, it immobilizes it for you so that you can't move it? Because you can't really heal effectively an area of the body that's moving a lot. That's one reason why wounds on, the creases or whatever of your hands or your feet that move a lot, they take a long time to heal. Whereas something that's on a piece of skin that doesn't move a lot, it'll heal right up. So non-resolving inflammation is really the problem when people are talking about inflammation. And it's also very, vague in and of itself, because the immune system has different components, different parts. And the reason that's important is that, when I think about inflammation, the easiest and most accessible analogy for me to give you is that of a police force or a military. At the end of the day, what the immune system does is it comes in and it's supposed to kill all the bad actors and drag the bodies out and dispose of them. And inflammation is like the process by which that happens. So saying inflammation is a little bit like saying fire. Is it the fire, in the, cartridge in the barrel of the gun that's firing the bullet downrange at the person who you're trying to get rid of because they're a bad actor? Or are we talking about the fire, in your kitchen? Or are we talking about, if it's a fire in your kitchen, is it appropriately contained, and is it cooking food on your stove, or is it, out of control and about to consume your house in an inferno, right? So all of these things are relevant. And what you really need to understand is that if you have chronic inflammatory problems, issues with just activation of the immune system for any reason, first of all, you've got to think about, well, what things in my environment are stimulating that arm of the immune system? Because many different things will do that. Secondly, if the immune response and the inflammation is appropriate, then what is the body trying to accomplish, and why can't it accomplish it? To give you another analogy, talking about non-resolving inflammation would be like talking about, non-resolving dampness or fire in your house. If there's dampness in your house, if there's a leak in your house and it never goes away, well, maybe you didn't have the resources to patch the roof or pay the roofers or whatever. If there's a fire in your house and it won't go out, maybe you don't have the necessary, water, fire extinguishers, whatever it is to put that fire out. So you got to ask the question, what doesn't the body have, and what are we doing to the body to trigger its responses? What is the point of this video at the end of the day? Inflammation is the body's natural response to injury, toxic exposure, infectious agents. Even stress can just trigger inflammation. And that means that you have to start with any question about what's creating inflammation in the body with what's the trigger? What's contributing to this? And this can be things that are coming into the body, negative external influences, or it can be things that you're not getting. And then within that, how is what the patient's doing, whether it's exercise or herbs or antibiotic use, affecting their immune system in such a way as to further alter what the body's doing with the nutrients that it has in response to the stressors that it's under? How about that? When you're ready to consultation with me, go to stillmanmd.com and fill out an application. I look forward to taking care of you. Don't forget to like, comment, share, subscribe, follow me on Substack and Telegram. As always, thanks for watching. Take care.